a great honor and indeed a great privilege for me to be with us in this special edition of You and Your Health. If you were with us last week, you got to see a development we should never allow to happen again. And that has to do with the development of the state of this young man, unfortunately late today, which we pointed out, despite the fact that it was said that the intestine was missing. But we look beyond that particular story by saying, how did all these things start? Is this something that otherwise could have been prevented? And that's exactly what we found out, that the genesis of the deteriorating situation actually emanated from this young boy having just appendicitis, which otherwise today is 25 minutes procedure even without tearing the body open. But regrettably, he had what is called ruptured appendix, for which they went to the hospital. It's a near-death situation. And on the basis of that, we also saw the need for us to look into preventable complications. We do witness in this side of the world, otherwise never would have happened. Today we get to see that I can't understand what's going on in our society. Nevertheless, we are having a lot of kidney failures, looking out for kidney transplant. Majority die because of the issue of money. Unfortunately, what wouldn't have taken any much money, this case was referring for us to think about who can send him abroad for intestinal transplant, which is in the present condition, nobody would even attempt that. So, how do we be in position to understand what may be killing our kidneys simply because of certain level of things either ignored or sometimes we appear to know more on what we think we are doing about that? You look at how infertility is raging the lives of our people. Majority of our couples today having marital crisis. You know how it started? Many of them couldn't be able to afford IVF. But this thing that also lead to issue of demanding for IVF, apart from the natural sequelae, we also see some things our people may have been doing, neglected or ignorantly exhibiting, and pack up their fertility future. I want you to invite everyone you know, and come on, we're going to take them one by one. This that happened, we can say today, affliction or such should never happen, not only in the issue of appendicitis, but also much more as we will look at it today. Stay tuned, I'll be right back.
You and Your Health with Dr. Richard Okoye. Join me to celebrate the Sun 2022 Public Service Icon Award winner, Dr. Richard C. Okoye. You and Your Health with Dr. Richard Okoye, now on TVC News every Sunday by 3:30 p.m.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye, the president of Doctors Save a Life Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. We consider this of urgent imperative to look beyond the condition of this young boy we discussed last week and also look at other areas. Our people have neglected a situation that otherwise preventable or curable with minimal demand economically to live in a situation where we should be beckoning for help. As in the case of, you see many people today, kidney failure, looking for assistance, this condition, looking for assistance. Are there things that actually we may have done On the other way around, or deciding by reason of no, don't go medical, go spiritual, go physical, go this and all that. Many of these we will see today. Let me give you the origin of this burning passion that Dr. Richard Okoye has come up over the years and trying to, as much as possible, break this medical terminology, if it's possible, to force it into your head, not to be so stupid, to be in position to fall victim of all form of manipulation going on in our society. During the time of HIV scourge, killing so many people, statistics came up then to 3 and stated that 72% of deaths recorded following HIV scourge, as of them, happened in sub-Saharan Africa, where we belong as a matter of fact. And it became a burden to me. Right there on CNN and other international television stations, the analysis boiled down to low socio-economic status of the people. Poverty is responsible for that. While I was watching, just like a revelational insight, he said the problem of Africa is not because of just poverty and infrastructural problem, that the problem of Africa is lack of health information. Assignment, as which I call it like a calling, he said decode these medical terminologies in a common man's language, that by so doing, you will save millions of people in Africa. Go save a life. And that's why the name actually become preeminent in most of our businesses and also establishment. Go save a life. It's just like a mission statement. And that has done enormously, a miracle as it were, in this side of the world, where this program has been able to bring home to people understanding why they are passing through where they are passing through. Because from inside, I go to realize that our fathers of medicine, not as indictment, actually contributed to the frustration many people do have in healthcare. The reason is that, quite unlike most studies, other courses studied with a mere terminology or English language people understand, our fathers of medicine coded medical terminologies in a way that a common man can't access. So if you don't pass through years of school in medical school, come on, as ignorant as you can, sorry to tell, irrespective of the title attached to that name. And unfortunately, that knowledge not being available. That's why if you look at medical terminologies, if you have something like malaria, instead of a doctor telling you have malaria, if he tells you have plasmodiasis, he's right in his own profession, but you are confused. If you read dictionary, the longest word in dictionary is a 45-letter word. It's called pneumono ultramicroscopic siliconiovolcaniosis. Bros, let me just tell you now. May that particular name I have mentioned now be the name of your own sickness. Quick, you will switch off this very television because you say it's not my portion. Back to sender. So because of the way and the manner, the whole thing has been, so made so big. And that's why most times you go to see a doctor, sometime after the doctor finish speaking, let the person come and say, what did the doctor say? He said, do I know? Na big grammar where they blow. And that's why people fall victim. Somebody will say, come, there's one product. If you drink this product, all the nyama where they inside their body, all of them will scatter. Is he a professor? We be drinking one nonsense, he can't even ask questions. It is as bad as that. And that's why the issue of selling intestine, issue of missing intestine and all that actually came in. Because perhaps the way of the communication of it, you want to say, where is the intestine? Can somebody tell me about it? That we discussed last week. And today, we are also looking into the subject that has to do with preventable complications in medical diseases. Should I tell you something? One of the things that are actually bringing tears to me right now is the rate of kidney failure in our society. A lot of issues, yes, diabetes, hypertension being primary, but you see younger people also suffering the same. And now, there are certain problems that can predispose to kidney failure. Hypertension, diabetes could be said to be chronic that most of you know. Treat yourself, that is one. But a person who has something like kidney stones will cause obstruction of urine coming out from the kidney down to the bladder. And when such happens, this your kidney, just get the picture, the kidney will start on its own, start getting enlarged, accumulated urine. If I lose it to you, just come to think about where urine is actually meant to stay back. Of course, you know what will be the outcome of that play. Over the time, apart from the bulging, that's why most of you will do pelvic scan. They look at the kidney. He said there is hydronephrosis. Hydronephrosis means hydro water. So it will just give that very enlargement. Something is obstructing that very flow. Over the time, if nothing is done on that cause of that very problem, which could come from the issue of kidney stone, a man who has prostate-related problem, you can't urinate well. Even sometimes you urinate, you discover that you don't pass out all. When there is such retention over there in the bladder, and it got infected, you know what will happen? There will be an ascending infection into the kidney, and once that happens, you may have what is called pyelonephritis. If there be nothing done over us, this becomes a problem that comes from time to time. That kidney can stop. It's hot because having been involved in the issue of kidney transplant, I got to realize that it's not just about the kidney failing. It is something beyond that. Issue that has to do with kidney transplant is not poverty friendly. That's why I'm crying out right now and said, whatever should affect your kidney, please stop. Please, whatever you know, even if it's ignorant, reverse it with the knowledge I'm sharing with you today. So it becomes important for us to think about some of the things. You may have kidney stones, somebody say don't bother about it. Even when you are having the pain, you may have the issue of urethral stricture. Urethral stricture is one of the things that is usually common in men, where maybe if the person has a gonorrhea in the time past, all right? When you want to go and wee, you will have this kind of, pepperish pain, all right? And sometimes it will cause the urine also to retain. And such also can give up an ascending infection. I discovered that in this side of the world, you see most of our women carrying fibroid that will be quite huge. Whatever they tell them, that I can tell. Don't go to hospital. It is a spiritual problem. Some will have very huge fibroid. They say it's not fibroid, it is fine boy. Come on, what kind of deception is that? When you see a pregnant woman, that very pregnant woman will now start having big tummy. All of a sudden, you see the leg is swollen and all those other things. The head of the baby can be pressing on the inferior vena cava for that to happen. But also, there is a particular location of the cervix that towards the downside of the womb. If you press downward with fibroid, it can cause what we call the urethra, that pipe where the urine comes out. It will block it. So you see the woman, because she's carrying fibroid, unknown to her, go and remove it. You say, no, her kidney is already being challenged. Some of them will be in position that they have those big things, and they are having a problem where you call anemia. Their blood level is not good. They are not bleeding, but their blood level is low. Something may be wrong with that kidney. Because the kidney produces erythropoietin that also helps in the issue of building blood level. So these are things that are preventable in our time. Very, very much preventable. And that's why I'm putting it that this particular case, let us say, let us go and do intestinal transplant. Hundreds of thousands of dollars may be spent if you are thinking, even if it is not as complex as this. And then, now we are seeing people having a problem which is preventable, and it ends up in kidney failure. And at that point in time, he said, there's no money elsewhere. Please, this can be prevented.
You and your health with Dr. Richard Okoye.
The greatest gift that can be given to somebody who has arthritis is not giving the person a car. It is not car that the person needs at that particular time. What the person needs is solution to the problem that will relieve that person of that pain, because it's very painful and it makes you sad. Even to eat food, sometimes you won't be happy to eat the food. Sometimes you feel like dying. It's better I live this life instead of facing this kind of pain. If this is a dream, may God not allow me to wake up, because I feel so good, I feel so calm, I feel like being in another world. Now I have no problem. I can walk well to any place I want without any pain. I can even do exercises. I'm ever grateful to Doctors Save Our Life Foundation for what God has used them to do in my life. They have done so well, and God will reward them.
You and your health with Dr. Richard Okoye, now on TVC News every Sunday by 3:30 p.m.
One more thing also to mention here is that there's what is called preeclampsia, hypertension in pregnancy. This preeclampsia is actually manifests in patients that are pregnant. Suddenly the BP starts going up, and you can also see protein in the urine. Whenever you see protein in the urine, it means that that very kidney is leaking. What it means is that also that the filter that filters things back, because the blood molecule and the protein molecule that are big, that it shouldn't be found in the urine. But whenever you see that very protein right there in the urine, something is wrong. So some women will have this and their BP start going on, protein is coming. Doctor will say, please get this baby out to save the life of this woman. The husband or the woman say, no, please don't. I can carry it. And she will carry it, and all of a sudden goes out. She may deliver the baby, but the kidney can pack up. And that's why today I I saw 3 ladies, because of childbearing that is God's blessing, today they have kidney problem because of neglected or poorly managed preeclampsia. So these things are preventable. That's where I'm coming. We must have to do something to avoid the sequelae like what we just saw last week. All right? Stay tuned. When I come back, we look at some of the things that people just do. I had a lady that my heart wrecked, that today this lady will not be able to get pregnant, even intercourse she will not be able to have, simply because of something ignorant in our society keep producing and making the life of so many men and women miserable. This young man is saying something that touched me. I want to also to reflect about.
I want to especially thank God for making me to have a successful kidney transplant. If you know anything that will damage your kidney, you should run away from them. Not everybody can be as lucky as I am. My advice again on young people is to stop taking drugs, smoking, and again, if you know you have high BP and diabetes, control it because it has been found to be the cause of kidney problem.
You and Your Health with Dr. Richard Okoye, now on TVC News every Sunday by 3:30 p.m.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye. Today we are looking at preventable complications in medical diseases. And we've pointed at a number of them. And we look forward to this. I have a young lady that actually came one occasion. And this very lady happened to have fibroid. Listen to this. And by reason of having fibroid, he said he went to the friend, and the friend actually pointed out that the mom treats fibroid. And what happened, he took the young lady to the mom, and the woman prepared a particular product and inserted inside her vagina. She said she felt hot sensation inside. And at the end of the day, all that and all that, the bad news is the vagina come together that today she can't see her menses every month. If she wants to see her menses, the pain will be all over the waist and no menses will come out. Of course, every month, blood will accumulate, macrophages will eat it up, waiting for another cycle. And menses will come. Now the entire vagina has been gummed together. So intercourse is equally 0. I saw pain, very pretty lady, but just useless by reason of certain level of ignorance in our society. You have fibroid, you say no, there's one drug, there's one concussion, there's one deal. Listen to me, in all honesty, there is no known drug that could be able to take fibroid out of the womb. There are ones you call gonadotrophin releasing hormone analogs, goserelin, lupron, lupron, zolades, and all the rest. But these drugs, if you are taking, can lead you to menopause. Very unfortunate what ignorance is doing in our society. And some women will leave the fibroid until the womb is damaged. Issue of pregnancy become a problem tomorrow. The same thing that happens like that lady can also happen when a young lady may have issue of abortion by mission or commission, and most times they will hide it. The thing will be having some oozing or pores and bleeding. You know what? At the end of the day, the womb will come together, and that's why some of them will be in position not to see menses, and some will be having all manner of stuff. If by reason of any crisis, any condition you had an abortion and had complication, friend, go to hospital. Something has to be done as quickly as possible before something do you. Many people are today having crisis because no money even to go for IVF. You don't need to take your life to that very level. That's why we are looking at things that are preventable, for which we use to clear all the demons and witches and all that. Today, the level of enmity in our society, everybody is an enemy to each other. Because this person is responsible for my problem and all those sorts. Come on. Ignorance is the mother of personal destruction. A voluntary misfortune, and it is worse when you are ignorant of your ignorance. Did you know today, issue that has to do with prostate, a laser prostatectomy within 2 hours can clear off the issue of obstruction. You urinate the way it's supposed to. Relieve the kidney from burden. The issue that has to do with kidney stone, no cut of body from anywhere. You can do this laser lithotripsy. The laser will go there and dissolve the stone. The pathway will be free for urine to come out. With the aid of this very laser fiber, this is what they call flexible ureteroscope. It's a 2022 technology, and today it's available in Nigeria. You can go in there, get the stone dissolved, and all those things, and you could be in position to have your life back again and save the kidney. Issue that has to do with a hemorrhoid. Laser today could be able to do hemorrhoid procedure for 10 minutes. Everything will shrink. You go about your life from office back to work. If these things are available, must we remain until complications start selling and we're looking for who to blame or what gods that may be responsible for your misfortune? Please, I want you just to share this as a summary. If you have somebody that is having certain condition, you can say, ask the person, go to hospital, and look at this very number. If you have any question concerning any medical condition, feel free to be in position to reach out on this particular number. Send a text message. We mobilize doctors across the globe even to answer you professionally. And more, we also coming up with our applications that can help you. Use my own clinic or use Dr. Save a Life to answer all those questions. At least, let us start from the known before we go to the unknown. God bless you as we will continue on this, and also see some cancers that are purely curable in our time, even in this country. God bless you as I see you again.